Dr. Ghatan, tell us what one should do if one burns himself, puts the hand on the hot stove or whatever it may be. What should a mom do with her child, or for that much an adult, as one of the first things until they make it to a doctor? And again, what shows the stage that they definitely should go to a doctor ASAP and not lose time?
Right. The first thing you want to do is to minimize the damage from the heat. And that you accomplish by using cool compressor. You can put ice in a bag and apply to the area of the burn, put it on and off, and that would prevent the heat from going deeper under the skin and causing more damage. That's the most important thing. Just put it on the cold water is okay, but it's not enough. Most people don't notice. Ice, cool it the best way you can, so that you don't allow the heat to go down deeper under the skin.
So what you're saying is that once you take the hand off the stove, the whole hand is hot and it basically keeps cooking almost, like an egg. Just because you take it out, if you don't put it under cold water right away, the egg actually will continue to keep cooking. Is that what you're saying? What's happening here?
Basically, yes.
Okay.
So that's why the first few minutes are so crucial to don't allow the heat to get deeper under the skin.
Okay.
Undo it by putting cold water on it, put ice on it, and then see a qualified physician who can take care of the wound. Burns can be sometimes very misleading. We have seen patients who come to us a week after they had a burn. Initially it looked like nothing. They went to emergency room, they gave him some topical cream, and they sent him home. And then a few days later, they get this blister, and it's painful, it's warm, it's red around it, they're developing cellulitis, they're developing infection. So, especially some parts of the body are more risky than other parts. For example, fingers, toes, foot, hand, and the face, around the eye, around the mouth. Those are areas, or the genitalia, or more sensitive areas. You have to be very careful. The skin is more delicate. You have to make sure that you cover all angles, prevent infection, prevent progression of burn, blister formation. If the blister forms, I have them come in usually, and I unroof the blister. I clean it, and we apply topical cream to help soothe the skin. And if it's very extensive burn, we encourage them to drink more fluid, because there's a lot of fluid loss. And I often prescribe antidiaspline mouth, because an innocent looking little burn on a finger in a couple of days can lead to a real bad cellulitis, bad infection. So, that's something that's sometimes it's overlooked.
So basically that burn, as you say, it grows. So basically you get a burn, cool it down as fast as possible so it doesn't keep going deeper and deeper, and then be prepared, keep it watching basically maybe, that over days it might get worse, and by doing so it can actually become infected very much so. And,
right.
and that's what you need to watch for, and be ready to go to a doctor. Okay.
Right. Obviously, if it's very expensive burn, you must go to the emergency room to a burn center. There are hospitals specialized in burn units, and that's the best place to be.
Sure, but there are lots of I've noticed that if something happens and there you are and you're burned. Sometimes you don't think that far, and you just, or maybe in a small town it may not be available. But anyway, but dermatologists are very specialized to fix those things, yes or no?
Well, some of us have more training in this area than others. I was fortunate enough to do training in a burn unit, so I learned a lot about burns, and I've been dealing with that since I started practice. Many of the dermatologists do not have extensive training in dealing with burns, so it depends on the doctor's experience and exposure.
Right. What about sunburn? Same type of phenomena? I mean, it obviously doesn't come fast, so let's just say a person falls asleep on the beach, wakes up and starts realizing the skin is all tight and all thing. And again, from experience, I know that it kind of keeps coming over the next few hours. You start shivering, getting fever. What's the first thing a person should do there?
Well, again, you're going to cool the skin. You can put cold compressor on. For sunburn, sometimes we give pain medication to help the pain. Non-steroidal anti-inflammatories, oftentimes, that are helpful. Sometimes they come to the office and I would prescribe a topical steroid for them to help it. And if it's any suggestion of a possibility of imminent infection, then I would give them antibiotics by mouth.
All right. Keep it cool.
Right.
Makes sense. You got it too hot, even it out. Get it cool. Thank you very much, Dr. Ghatan.